Hey everyone, and welcome to a special Sunday evening episode. I apologize for missing Thursday and Friday's episodes. It's been a very, very challenging and very trying week, actually weekend. And first of all, I owe all my patients that were supposed to come in on Thursday, I owe you all an apology. Hopefully you got phone calls from Angela. I had her come in and call as many people as we could off the schedule to let you know that I wasn't going to be there. So please accept my sincerest apologies. Your health is very important to me, but unfortunately I just could not be there. I had to be with my wife. Had a very, very scary weekend, but at the same time something that really kind of concreted my vision and what I really hope that this website can bring to people in a couple of ways. First of all, just to let everybody know, Kelly is okay. Kelly's my wife, for those of you that don't know. She is okay. She's back home. We just got home today, which is Sunday. She's been in the hospital since Wednesday afternoon. She had a very severe asthma attack that we ended up in two different emergency rooms and then being admitted and being in the hospital for, however many days that was, 3 or 4 days. The way that this kind of enhances the vision of what I'm trying to bring to you is I want to make it clear that when I'm talking about medications and the avoidance of medications and avoidance of surgeries and different things like that, I don't bring those up because I believe that they are the devil or that I believe that they're absolutely unnecessary, because that's not the case. My goal with this website and with these daily blogs and the information that I bring to you is to help you lead a healthy lifestyle, to help you lead a lifestyle where hopefully you are not ever in need of long-term medication, long-term medical health care. Okay, because once you get into that long-term medical health care, there are a lot of downsides to it. But with that being said, when medicine is necessary, when medical care is necessary, our system is the absolute best there is. And that time when it is necessary is emergency situations. Like my wife, for example, over the weekend, with her severe asthma attack, had I not taken her and had we not had the technology and the training of the people that we had here in town, it's hard to tell what would have happened to her or to our unborn child. But thanks to the incredible, systems that we have for emergency medicine and emergency management, everything has come out okay. And I'm very, very thankful for that. And I want to make clear to everybody that there is a time and a place for medicine. There were several things that happened during this course of events that I kind of want to bring up as examples of what I'm trying to explain to you guys, so that you're armed with the knowledge to go into these situations and handle them, as appropriately as possible. For example, my wife had a little bit of a sinus infection, no fever, just some congestion, and long story short, what ended up happening was she had some drainage that got into one of the upper lobes of her lungs, and it irritated her asthma, caused an inflammation, and she had an acute asthma attack. It was not pneumonia. It was, if it could have been pneumonia if we hadn't recognized the signs and gone ahead and handled it. But the point here is, when we got to the emergency room, the treatments, the protocols that they were going through, I was watching every step and making sure that everything that was done was medically necessary. And we came to that point that I knew we would, where the doctor wanted to do what's called prophylactic antibiotics. In other words, antibiotics just in case. And I asked the doctor, I said, do we have any proof and knowledge that there is actually a bacterial infection? There's no fever. The mucus being produced is clear. We're not in a situation where we know that there's a bacterial infection. And I'm not comfortable with her going on antibiotics until we know that there's something that this antibiotic can help. In fact, as a side note here, most colds are viruses. Antibiotics don't help that. Okay. And to this doctor's credit, he was very, very willing to cooperate, for lack of a better term. I've been in situations with other doctors where, they've blown off, the opinion if you disagree with that doctor and giving you a really hard time about it. The people that we worked with over this weekend were incredible, every single one of them, and I've got to give them all their credit. But anyway, so I asked him that, and I told him about my desire to know if there's a bacterial infection, before we, move forward with the antibiotics. And he was very amiable with that idea. And it's little things like that that I want you to understand. If you have a cold and you go to visit a doctor, it's okay to go get checked out to make sure it hasn't turned into something more serious. But don't take prophylactic antibiotics unless you know it's going to treat something, because that's how we get into antibiotic resistance, all these superbugs that we're hearing so much about. And that's how all these problems happen, especially when you're treating a virus with antibiotics, which doesn't help. Okay. But anyway, so, that happened. And there were a couple of little situations where, we discussed openly the treatment options, and we found better options versus, what the typical option that they were looking at was. And again, to their credit, everybody sat down. We had very lengthy conversations. It was incredible. But my point, and I think the major lesson with all this, is that I want you to understand that living a healthy lifestyle is your best defense. Okay, the best way to cure cancer is to prevent it. The best way to cure heart disease is to never get it. The best way to cure diabetes is to not kill your pancreas with a high carbohydrate diet. Those are the best ways to do this. And that's what my goal is to help you move into a healthy lifestyle before you are in need of the medication or the surgery or the drugs. But if you get to the point where you let that body go too far, you may become dependent on these things. We'll do our best at that point to try to get you off of them, but you really dig yourself a hole if you let your lifestyle run you into the ground. So, keep on tuning in. We're going to give you more lifestyle advice. And just remember that medicine is not the devil. All right. I hope this makes sense. I'm kind of rambling. Honestly, I'm quite exhausted. We'll get some newer, more upbeat shows on in the next few days. Oh, I also want to let everybody know that I'm not sure what our hours will be this week with the hurricane coming in. Just call on the voicemail and you'll find out, what our hours are. But on Monday, which is November 9th or whatever, I don't even know what the day is. Anyway, that Monday I'm going to be in from 7 to 11 because we do have a follow-up appointment with Kelly's OB. Okay, I hope everybody got the message here. I hope I didn't ramble too much and confuse everybody. And everybody have a great night. Take care. Bye-bye.